Sexually transmitted infections. These are infections and diseases that are transmitted through sexual intercourse. Transmission will occur if there is unprotected sex between one infected person and another. So the pathogens responsible for the diseases are transmitted through the sexual act. All these infections that are transmitted sexually can be prevented and controlled by avoiding indiscriminate sex or by use of condoms during sexual intercourse. There are many sexually transmitted infections. So here we only look at a few which are common in the population. The first one is syphilis. Syphilis is caused by the bacterium Treponema pallidum. The symptoms of syphilis vary depending on the stage. In the early stages, a person will develop one or more sores. The sores resemble large, round bug bites and are often hard and painless. In later stages, they experience a rash typically on the palms of the hands, like these ones here, the rashes on the palms of the hands, and also soles of the feet. Now, if the infection is not treated, it may then progress to a stage characterized by severe problems with the heart, brain, and nerves that can result in paralysis, blindness, or dementia. That is impaired functioning of the brain. It can also lead to deafness and impotence. In some cases, it can even lead to death if it's not treated. Syphilis is treated using antibiotics. I said control is by avoiding indiscriminate sex or by use of a condom during sexual intercourse. A second common sexually transmitted infection is gonorrhea. Gonorrhea is caused by a bacterium, Neisseria gonorrhea. Symptoms in men, for example, include discharge through the penis. It's some whitish discharge that comes from the penis. There's also burning pain when urinating and painful or swollen testicles. That is in men. Discharge through the penis, burning pain when urinating, and painful or swollen testicles. In women, there's also increased vaginal discharge of greenish yellow or whitish discharge. Apart from the discharge, there is painful urination and also vaginal bleeding between periods, because usually blood is discharged during the menstrual flow, but if one is infected with gonorrhea, suffering from gonorrhea, then there will be bleeding before and even after the menstrual flow. And in some cases, there may be abdominal or pelvic pain. Treatment of gonorrhea is by use of antibiotics. The third sexually transmitted infection is AIDS, that stands for Acquired Immune Deficiency Syndrome. AIDS is caused by the human immunodeficiency virus, or HIV. So there's a difference between AIDS and HIV. AIDS is a condition. It is a condition in humans in which the immune system fails, leading to life-threatening opportunistic infections. This condition is caused by the human immunodeficiency virus, or HIV. Now, in addition to sexual transmission, HIV may also be transmitted through sharing of contaminated skin-piercing instruments such as needles, through breastfeeding from an infected mother to the baby, mixing of babies and infected mother's blood during birth, and then transfusions and transplants of infected organs and tissues. Now, once in the body, the HIV infects and destroys white blood cells. Low levels of white blood cells in the blood leads to weakening of the immune system. With a weakened immune system, opportunistic infections set in, and at this point, the person is said to have developed AIDS, that is the Acquired Immune Deficiency Syndrome. The symptoms vary, and there are many, because the symptoms are due to opportunistic infections. So it all depends on the pathogens that has caused the infections. But the commonest of the symptoms include chronic diarrhea, because it affects the digestive system. So there's chronic diarrhea, there may be vomiting and nausea. Chronic or persistent coughing that lasts for more than 4 weeks is another cause, because it also affects the respiratory system. So there's a dry cough that can persist for more than 4 weeks, recurrent sore throats, and pneumonia. Skin infections are also common, which present as rashes. And also, other than the skin infections, the person may suffer from fever and night sweats. Persistent headache is another symptom. Now, it must be pointed out that these symptoms do not, on their own, do not necessarily mean HIV infection. They can be caused by other conditions. But when they occur, all of them together, they make up a syndrome. And that's why they must be several of them occurring together for them to be regarded as a syndrome for acquired immune deficiency. There may be joint pains and muscle pain also. And in all cases, there will be the swelling of lymph nodes as a result of the infections. Some individuals have nails becoming thickened and curved. And there's general weight loss and fatigue. That is body weight loss that is not explainable, there's no apparent reason as to why the body is losing its mass. So that could also be another symptom of AIDS. There's no treatment for AIDS. And just like the other STIs, is to avoid indiscriminate sex and to use a condom during sexual intercourse. A fourth STI is Trichomoniasis. The Trichomoniasis, in fact, is one of the most common curable STI that is caused by the protozoa Trichomonas vaginalis. It's caused by the protozoa Trichomonas vaginalis. Symptoms of Trichomonas. The symptoms of Trichomoniasis include vaginal itch and yellow or smelly discharge in the females, and urethral itch and discharge in the male. So in both cases, there is itchiness and discharge from both males and female. Treatment is by use of drugs such as the metronidazole, which is an antiprotozoan medicine. Again, control is by avoiding indiscriminate sex and use of a condom during sexual intercourse. The fifth, which is also very common, is the Candidiasis. Candidiasis is caused by the fungus Candida albicans. Candida albicans is a fungus that occurs on wet surfaces, like especially in the vaginal environment. Symptoms of the Candidiasis include itching and irritation in the vagina, redness and swelling or itching of the vulva, white discharge, pain during sexual intercourse, and a burning sensation during and after urinating. So Candidiasis is more common in the female than in the male. Treatment of Candidiasis is by use of antifungal drugs. Sixth STI is the herpes. Herpes is caused by the herpes simplex virus. Infection with the herpes virus is categorized into one of several distinct disorders based on the site of infection. Oral herpes, the visible symptoms of which are known as cold sores or fever blisters. So here, like you have this oral herpes. So the type of the herpes depends on the part of the body that is infected. That is the site of infection. So oral herpes will appear as blisters around the mouth. And oral herpes is the most common form of infection. Then there's also the genital herpes that appears as the herpes lesions. So the genital herpes, known simply as herpes, is the second most common form of herpes after the oral herpes. Now, herpes simplex is most easily transmitted by direct contact with a lesion or the body fluid of an infected individual. Transmission may also occur through skin-to-skin contact. Symptoms, as we mentioned, are these lesions that occur on different sides of the body. And treatment for herpes is not possible because the cure for herpes has not yet been developed. And once infected, the virus remains in the body for life. Then the last of the common STI is hepatitis. Hepatitis refers to the inflammation of the liver, and this inflammation may be due to viral, bacterial, fungal, or parasitic infection. It may also be caused by drugs and alcohol. Now, here we're referring to the hepatitis that is caused by infections through sexual intercourse. Such hepatitis is transmitted by having unprotected sex, that is, without condom, with an infected person. If there is penetrative sex with an infected person, then the causative agent, be it a virus, a bacterium, fungus, or these three especially, will be passed on to the uninfected person. The symptoms, and in particular, there are 4 different types of hepatitis. There is A, B, C, D. Now, it is mainly hepatitis B that is sexually transmitted. And the symptoms of hepatitis B include nausea and loss of appetite, vomiting and diarrhea, weight loss, itchy skin, and jaundice, which is yellowing of the skin and the white parts of the eye. So you can see here, the white part, the cornea, becomes yellow. Even the skin generally becomes or takes on a shade of yellow, and that condition is what is known as jaundice. So control and prevention, again, is by avoiding indiscriminate sex or unprotected sex, and also use of vaccines to prevent infection.